Domestic work. An adolescent girl, Sunita, working as a domestic maid, concerned by generalized itching and patches of rash all over her body, consulted a nearby doctor for relief. The doctor examined her and came to a conclusion that this is an allergy caused by something in food to which she may be allergic. She was given an antihistamine which caused her drowsiness and was severely punished by her employer. If her working conditions were known to the doctor as a response to his simple question, "What exactly is the nature of your work?" he would have known that she is constantly in contact with a detergent. Effective history taking has long been identified as a core discipline in treating patients. Spending more time compiling a good patient history has been known to provide the most benefit as compared to long physical examinations and expensive laboratory tests. Collecting an incomplete history can affect initial therapy and all subsequent decisions for treatment. Therefore, it is essential that primary care physicians ensure that neither the patient nor the health system is unduly burdened by deficient history taking. Primary care providers and family physicians can play an important role in improving the recognition of occupational disease, preventing progressive illness and disability in their own patients, and contributing to the protection of other workers similarly exposed. This role can be maximized if physicians raise their level of suspicion for workplace disease, develop skills in taking occupational histories, and also learn basics of advising prevention. Industry profile. Domestic workers make up 4 to 10% of the developing world's total workforce, and according to the ILO Bureau of Statistics, this number is growing every year. Therefore, domestic work is an important source of employment, especially in poorer parts of the world. Increases in rural poverty and various economic crises have pushed growing numbers of women and girls into the domestic labor market in their own countries and abroad. Many more women than men are drawn into this occupation, not only because domestic work is often considered women's work, but also because women are less likely to have alternative ways of earning a living. Another likely scenario that has emerged over the years is of second-generation domestic workers. Daughters of domestic workers are also expected to take up the job. In the bigger cities, the husbands of these domestic workers are unemployed or are working in jobs where their wages are not sufficient to support their families. Distribution of workforce. Types of domestic workers based on the hours of work and nature of employment relationship. A. Part-time worker or worker who works for one or more employers for a specified number of hours per day or performs specific tasks for each of the multiple employers every day. B. Full-time worker or a worker who works for a single employer every day for a specified number of hours, normal full-day work, and who returns back to her or his home every day after work. C. Live-in worker or someone who works full-time for a single employer and also stays on the premises of the employer or in a dwelling provided by the employer. D. Seasonal worker. There are workers who are engaged only for selected and limited period. As these are mostly migrants, their interest is to make as much money as possible in a limited time, and the aim is to go back to the native places, even though in reality this may not occur. These workers are usually relatives of domestic workers who are called to lend an extra helping hand during weddings, festivals, special functions, or parties. E. Corporate houses often hire or outsource housekeeping work to special agencies that employ domestic workers. These workers, though a part of an organization, have very little to speak of as advantages over unorganized domestic workers. F. Event management companies also hire domestic workers, mostly on daily wages, and most often there is no direct employment contract between the domestic workers and the event management companies. They are nobody's responsibility should any mishap occur during an event. G. The last and probably the worst category of employment is the domestic worker who is nothing short of a bonded laborer. Many incidents have come to light where women and children are lured from rural areas by domestic worker agencies who then broker a deal with an employer for delivering a worker who is then trapped in the house as a bonded laborer. Unable to escape, such workers are often subjected to isolation and physical abuse. This is perhaps the only informal sector where it is considered normal in many Indian households to have a child worker employed for cleaning the house or doing the dishes. Characteristics of work. Generally, domestic work falls under 4 categories. 1. Kitchen work. 2. Housekeeping and house cleaning. 3. Clothing care. 4. Child and elder care. Children as young as 7 years old are routinely pressed into domestic service. Child domestic workers or CDWs are isolated from their families and from opportunities to make friends, finding themselves under the total control of employers whose primary concern is often not in their best interest as children. Despite some children entering domestic work in the hope of continuing their schooling, many are deprived of opportunities for education and are working in conditions that can be considered amongst the worst forms of child labor. Worldwide, the majority of CDWs are girls. Many have been trafficked or are in debt bondage. Following are the characteristics of the work issues that domestic workers routinely face as part of the work they do. Domestic workers are subjected to continuous periods of work without any substantial period for rest or refreshments in between. When one task gets over, they have to take up the other task. Physical hazards. Domestic workers have to lift loads without any support, walk over slippery floors, handle extremely hot floor or extremely cold ice substances, and work with electrical equipment without any protective measures. Additionally, they have to clean rooms with a lot of dust. They may also be subjected to physical abuse. Chemical hazards. Domestic workers routinely handle several potentially toxic and harmful chemicals as part of their daily activities. These include diethylene glycol found in window cleaners, formaldehyde found in spray and wick deodorizers, petroleum solvents in floor cleaners, perchloroethylene in spot removers, butyl cellulose found in all-purpose cleaners, and chlorinated phenols found in toilet bowl cleaners. Biological hazards. Domestic workers usually have to deal with disposal of leftover foods or decaying material. They have to clean rooms that are dusty and contain spider webs, fungal growth, or are termite infested. They also have to deal with biological waste when taking care of incapacitated or extremely old people. Additionally, many employers give them stale and spoiled food, assuming that domestic workers can consume food which is not suitable for employers' consumption. Psychological abuse. Domestic workers are usually shouted at, scolded for small misdemeanors, and usually not treated with dignity or respect. There are certain humiliating practices drawn from the centuries-old and inhuman caste system which can still be seen in some instances. Sometimes domestic workers are forbidden from touching certain objects in the households, such as idols of gods and goddesses, certain utensils, and rooms in the house where prayers are offered. In some instances, domestic workers are not allowed to enter the house through the kitchen. Domestic workers have to go around the house in order to avoid getting into the kitchen. Most often, domestic workers pretend that it does not affect their self-respect and continue to work, suppressing their anger and humiliation. Their work is often devalued or perceived as no work. Stress. The compulsory drill or routine of domestic work without any respite, plus domestic pressures and having to literally do the same back-breaking work every day, takes its toll on domestic workers. While at work, domestic workers face severe problems even in attending to nature's call, as most employers won't let them use their washrooms. Domestic workers who live in the employer's home have to do everything from washing, cleaning, ironing clothes, going to market and buying groceries, vegetables and fruits, to feeding and taking care of children and taking care of the elderly. Their duties include serving the needs of all the members of the family, big or small, and they are expected to be on their toes the whole day. They are the first to wake up and the last to go to bed. Some domestic workers who live with their employers have to look after the children even during the night as per the child's schedule. They are not paid any overtime money for the services rendered during odd hours. Sexual harassment and abuse. Though not openly spoken about, workers of both sexes may be subjected to harassment or abuse. These matters come to light when complaints are filed and action is taken, which goes to prove the incidence and prevalence of such events. Health problems and disease patterns. Hazards related to health and safety are more or less shared by all these activities. Domestic workers are prone to a large variety of health problems. Health hazards of these workers are described below with their causative sources and manifestations. Health condition and causative source. Dermatological conditions. Irritant contact dermatitis. The degree of damage following irritant exposure depends on the potency of the irritant, the duration of application, the frequency of exposure, occlusion, temperature, anatomical site, and individual susceptibility. Causative source. Contact with detergents, vegetable juices, wet work, or too much exposure to water. Perniosis. Chilblains. Fingers and hands are affected due to capillary beds under the skin. Causative source. Humidity, working for a long time in water. Paronychia. Nail bed infection from Candida albicans. Causative source. Hand dermatitis and wet work also predisposes to yeast infection. Allergic contact dermatitis. Symptoms subside after skin is no longer in contact with the allergen. Causative source. Some domestic workers are prone to skin allergies because of the high use of these detergents. Injuries and musculoskeletal conditions. Contused and lacerated wounds and injuries. Small wounds may worsen and gape due to poor or no first aid or delayed treatment. Cause. Cuts and tears may commonly occur while cutting vegetables, cleaning floors that may contain pieces of broken glass, working with sharp nylon wires, or using brooms that are tied with metallic strings that can loosen out, or even while cutting up or opening tin cans. Burns and scalds. Thermal and electrical burns are known to occur as well as scalds. Causative source. Handling extremely hot substances such as flour or hot water without any protection. Working with damaged equipment or machinery such as pressure cookers without gaskets or refrigerators with faulty compressors that may explode. Pain. Back pain. Causative source. Washing, cleaning, bending constantly, or adopting unhealthy postures while performing tasks like lifting heavy objects or cleaning ceilings or corners that are not easily accessible. Physical violence. Bruises, contusions, ecchymosed areas, and sometimes even fractures. Causative source. Signs of physical violence and abuse are apparent, and the reasons given by the patient, such as slips or falls or accidental bruising, may not be consistent with the anatomical position and the extent of the injury. Sprains and crush injuries and fractures. Mostly of wrist, hands and feet, but may even be present with fractures of arms or legs. Cause. Usually falling from a height while lifting heavy loads in an awkward manner. Infectious conditions. Gastroenteritis shigellosis, amoebiasis, diarrhea, and dysentery. Causative source. Contaminated water, poor sanitization and hygiene, poor nutrition, and consuming contaminated or partly decayed food. Malaria, dengue. Option: dengue and other mosquito-borne diseases. Causative source. Working in damp places or areas with stagnant water or mosquitoes. Enteric fever, typhoid. Causative source. Consuming contaminated water or food. Nutritional conditions. Anemia, hemolytic as well as hypoplastic. Cause. Iron deficiencies, infections, and constant self-medication with non-steroidal anti-inflammatory drugs, contact with toxic substances such as butyl cellulose leads to bone marrow suppression. Vitamin and nutritional deficiencies. Causative source: lack of a balanced diet. Respiratory conditions. Occupational asthma. Causative source: damp houses infested with mites, rodents, cockroaches, and respiratory viruses. Rhinitis, bronchitis, upper respiratory tract affection. Associated with mucous membrane irritation and decreased pulmonary function. Causative source: exposure to formaldehyde, petroleum solvents and phenols. Tuberculosis, pulmonary or bovine. Causative source, living in crowded or cramped places, consuming contaminated milk, poor hygiene or sanitation, being exposed to places where people openly spit or snort. Behavioral conditions. Depression. Causes: constant humiliation, isolation from one's family and community, lack of paid vacation and sick or maternity leave, inadequate protection of wages, rape, physical and mental abuse, overextended working hours, and general lack of benefits. Anxiety. Causative source: being constantly on one's toes, apprehension of losing one's job, or being pulled up for mistakes or crimes that they have not committed. Ideal recommendations for health, safety, and welfare of domestic workers. Some kind of legislation has been suggested, but it is not yet implemented to address the following issues. 1. Working time. Weekly hours, hours worked at night, and weekly rest periods. Standby, freedom to leave the house. 2. Living conditions. Accommodation, privacy, food and water. 3. Social Security, OSH. Sickness, injury, maternity, invalidity. Safety at work, sexual harassment. Unemployment and pensions. 4. Leave, maternity, privilege, casual and sick leave. Preventive interventions require strategic contribution and efforts from government through occupational health and safety policy and legislation, cooperation from employers as well as workers, and advice from medical professionals. Occupational diseases manifest after long latency period from the time of exposure. There are challenges to establish and declare that a disease is due to hazard at workplace. Elaborate guidelines for management and prevention of occupationally caused diseases is beyond the scope of this documentary, as currently there is no mechanism for doctors to enforce their recommendation without a statutory backing. We therefore give general principles of prevention. Preventive measures should be designed and implemented at 3 levels of prevention. 1. Primary prevention aims to reduce the occurrence of disease by eliminating the cause of disease, for example, use of benzene-free solvents or solvent-free paints to eliminate the risk of carcinogenicity, or reducing exposure to safe levels that prevent it from causing damage, for example, reducing noise at its source to levels that do not cause noise-induced deafness. 2. Secondary prevention to identify and treat health problems as early as possible, often before symptoms have developed, in order to take corrective action. For example, regular audiograms among workers exposed to high levels of noise in the work environment. 3. Tertiary prevention aims to avoid complications of and disability from illnesses and injuries and/or to provide rehabilitative and palliative care. It aims to minimize the consequences in persons who already have disease and depends on appropriate treatment. We expect that the primary care physicians are already well versed with clinical knowledge for management of the occupationally caused health conditions. To learn more about detailed clinical perspective, treatment and prevention and control, please refer to e-book or printed version of BOHS for Informal Industry, Manual for Primary Care Providers. So, if your next patient with any of the presenting symptoms we described earlier comes for treatment, please don't forget to ask him the million-dollar question. What exactly is the nature of your work?